is Sarah. I'm a nurse practitioner student, and I'm going to be assessing your cardiac and gastrointestinal system today. I'm going to start by feeling your carotid pulses one at a time. I'm feeling for the regularity of the pulses and feeling for any thrills. Next, I'm going to auscultate your carotid arteries for any bruits. I'm happy to hold your breath. Good. And release. Hold your breath. Good. And release. Good. And I'm not hearing any bruits on either side. Next, I'm going to inspect your chest wall. Angela does not appear to be in any distress. She is nice and pink and warm. There's no diaphoresis, and I'm not visualizing any lifts or heaves coming from her chest. Next, I'm going to listen to the 5 heart sounds. I'm going to do this with my diaphragm, but in real life I would use my bell and my diaphragm. And I'm also going to do this, I would also do this with you laying down. So I'm going to, at your second space, this is your aortic. Feeling for any murmurs or any irregularities. Your pulmonic, your second left space. Second pulmonic, your third space. Your tricuspid at your fourth space. And at your fifth space, which is where her PMI will be, the midclavicular line. Good, sounds good. I'm also going to palpate your PMI here, and I'm feeling for any heaves or any lifts. Her PMI is regular, V is regular. All right. The next thing I'm going to do is check your pulses. I'm going to check your radial pulses here. They're even symmetrical. Your brachial. Your arms here. Good. And I'm going to have Angela lay down so I can check her femoral, popliteal, and her lower extremity pulses. Your femoral pulses here, your popliteal, dorsalis pedis, and posterior tibial. Okay, which are all symmetrical and even. As I'm going through with my pulses, I'm checking for edema, any swelling, feeling her skin. She feels nice and warm. There's no coolness with her skin. I'm checking her capillary refill on her fingers, which is less than 3 seconds. And then on your toes, which is also less than 3 seconds. So the next system I'm going to move on to is the gastrointestinal. I'm going to start at the foot of the bed, and I'm going to inspect Angie's abdomen for symmetry. Her abdomen appears to be symmetrical. I'm assessing for any movements of peristalsis. I'm assessing for any abdominal distension, which our abdomen appears to be nice and flat. I'm also assessing for any hernias near her umbilicus, which everything appears to be great. Her skin is nice and pink and warm and dry. So the next thing I'm going to do is auscultate Angela's belly. Hold on, I'm missing something. Angie, I'm also going to check your skin. When I'm assessing your skin, I'm looking for any jaundice, any palmar erythema, any spider angiomas, and any rashes or any skin discolorations anywhere. All right, next I'm going to move on to auscultating your abdomen. So I'm going to start in the right upper quadrant, listening for your bowel sounds. Bowel sounds are present in all 4 quadrants. The next thing I'm going to do is auscultate for any bruits in your, first I'm going to do your aortic. Next I'm going to assess the renal arteries. And your iliac arteries. Okay. Next thing I'm going to do is percuss Angela's abdomen all throughout in all 4 quadrants. And I should hear tympany throughout, and possibly hear hyperresonance near her umbilicus. If I hear dullness, then that would indicate a solid organ. And the next thing I'm going to do is percuss your liver. So I'm going to start on the right midclavicular side, right below the umbilicus. And I'm going to move upward until I hear dullness. Okay, which I hear right here. And then I'm going to, lift up your shirt here, Angie. And I'm going to progress downward until, down upwards and then downward. And I'm going to draw a line where dullness was heard on the top and the bottom, and that should not exceed 7 centimeters. The next thing I'm going to do is percuss for your spleen, which I would start at your left costal margin. Alright, and I hear this is where I would hear for your spleen. The next thing I'm going to do is palpate your abdomen. I'm going to start by light palpation. I'll start in the right upper quadrant. Do lightly circular motions with my hands. Light palpation. Then I'll move to moderate palpation. And then deep palpation, I'll use 2 hands and palpate deeply, which I will not do, but I'm verbalizing for our checkoff. The next thing I'm going to do is palpate for your liver, which I should not be able to. I'm palpating, feeling for any hepatomegaly. And then I'm also feeling on her left side for splenomegaly. Which I do not feel, so your liver and your spleen feel to be in normal limits. The next thing I'm going to do is palpate for an aortic aneurysm, which I should feel, I'm going to feel the pulses on both sides of her aorta. And this should not exceed 3 centimeters. And if it did, I would be concerned about an aortic aneurysm. Okay. The next thing I'm going to do is palpate for the Murphy sign, which let me have you take a big deep breath in. Good. And I'm testing for cholecystitis. If she were to have pain with inspiration when I palpated underneath her right rib, that would be a positive Murphy's. The next thing I'm going to do is palpate for the McBurney's. I'm going to place my hand between her umbilicus and her right anterior iliac spine and feel for any tenderness. Do you have any tenderness? That may indicate appendicitis. And then I'm also going to feel for rebound tenderness in this area, which may indicate appendicitis also. So I'm going to press in and then quickly release. Do you have any pain?
No.
Okay. She is not having any pain, so she has a negative rebound tenderness. And the next thing I'm going to do is the obturator test, which I'm trying to place pressure on her appendix. Are you having any pain?
No.
Any pain?
No.
Okay. If she did have any pain, that would be a positive obturator test. And I believe that is it. We did the Murphy's, we did the rebound, we did the obturator, and we did the McBurney's. Okay, that's it. Thank you very much, Angela.
Thanks.